Okay, so let's start. I'll start with a brief introduction of myself. I'm sorry. I have bad allergies. I live in Tennessee and it's the allergy season. I would actually say all 12 months are allergy season in Tennessee. So my name is Kakali Bhattacharya Chakrabarti. I am an assistant professor of communication in Austin Peay State University, as it says here. So I work, I'm primarily with the Department of Communication, where I teach speech communication and also communication research methods. And I work I'm an affiliate faculty in Department of Health and Human Performance in our Master of Public Health program, where I usually teach public health communication, but I also sometimes teach an undergraduate course in communication and advocacy. So this journey started when I was a graduate student, and I was in this course on qualitative research methods, or how to use community-based and qualitative research methods in health communication. Before I moved to US for my graduate program, I was a researcher back in my home country. I'm from India, and I worked in India for about 9 years as a researcher, working with communities. And when I say communities, they were anywhere from subsistence farmers to scientists. And I've also worked with head of states. I've worked with scientists and architects in IPCC. That's my journey as a communication professional. And I've always been more interested in eliciting responses when it comes to health risk at the community level, and also bridging the gap between experts, or who we would call experts, people with academic qualifications, and communities who are the ultimate beneficiaries of any health programs that we can think of. So when I was a graduate student, I would say it was a course, it was a class, a content that I was trained in, called body mapping. And my instructor was a very interesting instructor. Everything that he taught, it was on the job training kind of thing. So it was very practical. We did it ourselves, and then we went through that training multiple times. So, and then I started organizing more and more workshop on body as a storyteller. So right from that journey to all the workshops that I have done, I have realized that when it comes to health communication, the main challenge in health communication is not what to say, but how to say, and how to elicit responses that are honest and would help the risk managers, or so-called experts, in actually providing some solutions to the health issues communities are facing. As we can all understand, one of the challenges might be language. One of the challenges is also cultural differences. So when we do something like body mapping, it kind of removes some of those barriers. It helps bridge the gap between communities and experts, for example, risk managers, government officials, doctors, and any health care provider. So a little bit of what body mapping is. Body mapping is a creative therapeutic tool that brings together the bodily experience with visual artistic expression. So it's expressing our bodily issues or bodily experiences, not through linguistic means, but more through artistic expression, colors, symbols, and different kinds of images that we can draw. It has been used quite extensively in different kinds of health communication. but not exactly what we would call health communication in an academic setting, but more community-based setting, to detect or to speak about traumas, injuries, emotions, and feelings, and psychological healing. It's not, obviously, it's not medicine. It's not anything that can actually treat injuries, but it helps people express what they're experiencing, and that's how it helps in psychological healing, or it may help in psychological healing when it is conducted through different stages. And it is a way of communicating, and it is a way for the healthcare professionals, or it may be a way for healthcare professionals to understand what the patients or what someone is going through when it comes to their health. Something that might not be possible, might not be easy to express because of, again, language or cultural barriers, or maybe simply because of the health issues, the nature of the health issues. So it has widely been used or experimented to talk about sensitive sexual health issues. I don't know what I'm constantly doing. Sensitive health issues, sexual health issues. The first time body mapping was used was to rehabilitate or with women who were recovering from breast cancer. They didn't have breast cancer at that time. They were declared cancer-free. But because breast cancer doesn't have just one physical effect, it has multiple emotional impacts as well. So the first time initial body mapping body mapping exercises were done to talk about those issues. Also, it has also been quite widely used for HIV rehabilitation and HIV to talk about HIV issues, which we all understand are quite sensitive to talk about. It has also been used by health communication researchers in a more academic setting, but widely for community-based participatory health campaigns, just to understand the underlying and more deep issues within certain communities. So let's move to what we do in body mapping, or how it is usually conducted in a community setting. Body mapping is not, unlike many other qualitative research methods, body mapping is not exactly a plain research method. It has different steps, but it is almost always in a communal setting. It is not one-on-one communication, but people come together, gather together, and then this exercise is conducted, and then we have a extensive, elaborate debriefing process. And through that debriefing, people share their experience with body mapping and what they represented in that body mapping. And that's how some of the communication or some of the tensions or some of the issues are talked about, and it helps in the process of empowerment and psychological healing. So so now this slide is talking about specific technique. It involves people to trace, most often by a partner, their body in a wide paper. So most commonly, when it is done in a traditional setting, not in an online setting, participants are partnered with someone else, and one partner will help trace their entire body in whatever position or whatever posture the participant wants. And then the other partner will help that. Most commonly, participants lie down on the floor or just stand back in a wall, and where big brown papers are first put in there, and then they trace the body that way. People then identify or represent their identities, their aches and pain, emotions and feelings, and deep thoughts onto the traced image of the body. And then participants can use art, colors, pictures, symbols. And even though it is not a requirement, but they can also use words to represent their various experiences. And when done in a group setting, the group members then share their art and what they represent. So I'll come back to the third point a little bit. As I had mentioned earlier, that it also helps break the linguistic barriers. So words are only used when words have a lot of meaning in that, but words are not one of the essential elements in body mapping. And then in a community health intervention scenario, so I'm just assuming that many of us probably work in those scenarios or in those settings, participants may use body mapping or health intervention. In health intervention, it can be used to identify and map internal and external challenges with health and wellness, and then pain and discomfort, feelings and thoughts, physical and psychological trauma. It can also help in understanding different societal expectations or stigma about certain situations. For example, HIV/AIDS. For HIV/AIDS, this body mapping has been widely used to understand the stigma, and participants or someone who is suffering, who is undergoing some kind of treatment or has an intervention about HIV/AIDS, what are the societal expectations or stereotypes they often experience being living with HIV/AIDS. And then it also represents their strengths and opportunities that they find within their limitations or within their what are the strengths and opportunities that they either experience or they anticipate within their social or health situations. So before I move on, is there an opportunity for us to quickly introduce the participants so that I know where you are coming from or what your experiences are? I'll stop the sharing and then we can probably quickly introduce ourselves. I have Rebecca first on my screen.
Hi.
Hi.
I am the community resource person at the Central Arkansas Library System. And I do, in addition to serving the patrons, especially those who are homeless, I provide training for our staff. And I just wrote myself a note on the notes that I'm taking that I think this would be a lovely training for our staff. Libraries tend to, or at least our library system has a higher rate of folks with anxiety. And anyway, I won't take everything up, but this is lovely.
Thank you. I have VHA, STCS, role. Am I on my screen next? I have Melissa Fulton next.
Good morning, good afternoon. I'm Melissa Fulton. I work at the Intertribal Council of Arizona as the vaccine epidemiologist, and I am here to learn some innovative ways on how to communicate with our communities. Thank you.
I have Ambarish next on my screen.
Good afternoon, good morning, everyone. Ambrish Sharma. I work at the Oregon Health and Science University as Senior Informatics Manager, and I'm also co-founder of Medagio, which is a health literacy and health education startup. It's great to be here. Thank you.
We have Manleen next on my screen.
My bad. Hi, everyone. My name is Manlane Randawa. I am a health educator at Partnership Health Plan in California. We are a managed healthcare plan for Medi-Cal.
We have Darian Fuller next on my screen.
Hi, I'm Darian Fuller. I'm also with Intertribal Council of Arizona. I work there as the HIV STI epidemiologist. And thank you for putting on this presentation.
Thank you. I have Linda Steinberg on my screen last.
Hi, everyone. My name is Linda Steinberg. I'm the Illinois Department of Human Services Home Visiting Program Manager. We serve over 52 home visiting and coordinated intake programs throughout the state of Illinois. And quite often that includes supporting our families with health and wellness information. So just here to learn some new and innovative techniques to improve the health literacy across Illinois.
It's lovely to hear from all of you and your connections with different communities, and the communities, I would say, I'm a college professor to begin with, but even though, I mean, since I moved to more than halfway across the world, I would say in the middle of my life, I mean, where I am right now, I'm moved quite late. And I say that this is my second life. So in my previous life, I was a community health educator or liaison person, and I crossed the bridge between experts and community. And now as a college professor, I always try to understand the different challenges we face and different communities we deal with. And so right now, even though my community is my students, I'm not directly working as a health educator, but I do work with our health and counseling services. So it's always great to understand from different people's perspective on what they want to know, what they want to gather from a workshop like that. So this gives me a little bit more idea of different areas of your work. So I'll share my screen one more time, just to show you, some examples of previous work that these are not my work. Sorry. I don't know what's happening with my computer today. It's like going in the other direction. So this is, I don't know if you can see it. This is a work from different projects that have worked before using body mapping. And as you can see in the first picture, I use these as examples just to give you an idea how different people have used different postures and how different expressions can be, different art or different methods can be used to express their feelings and thoughts. So in the first picture and also in the second picture, there were two body mapping in two different postures. That is also an option. And in the first one, and both of these were from, examples are from Africa. And it was about HIV/AIDS and what they understand and how their social standing has changed. Sorry, the first picture was, I don't exactly remember the first picture, but the second picture was a breast cancer survivor. That's why we see there is a kind of pinkish ribbon And the language is a Tanzanian language. That's why I can't read all of them. But this was expressing their emotions that are within them and their social surrounding, and how their social surrounding is impacting their being a breast cancer survivor. In the first picture, we can see there are crosses and how religion is helping them. These are other thoughts that can be expressed. These are more complicated. This is from the same series. And again, there are multiple postures in every picture. That is another option that the participants can easily use. They can draw themselves, they can trace themselves in multiple different postures. And what it represents is what is within them and what is outside them. It is also about control and expressions. I believe these are from other topics, but I don't exactly remember what they are. But as you can see, they are very contextual. If you are in that setting, you would understand. And some of them are also about so far I remember, these are from HIV/AIDS that I had talked about before. And it does say, yes, it does say HIV plus on top, and the social stigmas around it and how those social stigmas are affecting, even though they are outside them, but how is it impacting them inside? Same continues, but I think one of you mentioned about anxiety. And so body mapping anxiety, this is from one of the classes that we did, and how anxiety as students help us overcome certain struggles, or also leads us to more and more struggle. And this is one that we would be doing right now for next 10-15 minutes. This can also be done in a small piece of paper. So this is a prompt that I thought we can do right now in our workshop, since we are not meeting in a physical environment. We are all virtual. So if you have this kind, and I had put in this request that everyone should have at least an A4 size paper and something to write on and something to write with. You can use any kind of paper, and then you can just draw an outline of a human figure in a letter size paper. And then using this prompt, what is your main challenge in communicating about health with your audience? And so in this, you can consider challenge as something good or problematic. What are your opportunities in communicating about health? And whatever that audience is, whatever the health issue that you are specifically working on. I think one of the participants mentioned about homeless population. One of you mentioned about working with HIV/AIDS. One of you mentioned about anxiety, if I remember all of them correctly. Then you can mention, you can specifically focus on that health issue. Whichever way you communicate, if you communicate in a healthcare setting, whether you communicate in a more community-based setting, whether you go to your community or your community comes to you. I remember one of you mentioned about being in a library setting, or if you work with DHS, then what does a community or audience mean, and how do you communicate? Do you go to them? Do they come to you? So what is communication That is another definition that you can just think of. This, again, communication, health, and audience, and challenge would mean very different thing for all of us. So just keeping this prompt in mind, identify the internal factors of your challenges, something that is, then place them inside the outline of the body, and then identified external factors, sorry, there's a typo, identified external factors of your challenges and position them outside the outline of the body. And identify within those factors what you can control and what you cannot control, and mark those with different colors. If that is possible, when I do this kind of workshop with my students, I just ask them to move them either inside or outside the body, depending on when they think that they have been able to move them. They have understood what they can control or what they cannot control. So I'll stop sharing so that I can see all of you, at least the screen. So is it using the reaction, that thumb sign reaction? Is there any question, or is it okay for us to use the next about 15 minutes? We have till 12:15. I'm in Central Time Zone. So I'm kind of, I have to check the time actually. So we have another half an hour for the workshop to be over. So next 15 minutes, I was thinking that we can utilize drawing that piece of paper, drawing in a piece of paper. And if possible, then we'll just put it up and we'll show and we'll do a debrief. Is that okay with a show of thumb? If you can just show that that is okay, or I can just explain more how we can do it. Okay. So for next 15 minutes, we will draw so this is our prompt. And this is what we would do. If we just want to draw a stick figure kind of an image, that's also fine. The main purpose is to just have an outline of a body. So, and if you want to draw more realistically, that's fine too, because since we are not able to trace it, whichever way you are able to express a body, that is fine. Doesn't have to be anatomically perfect, but if you can just draw something to represent a body, that's what we are looking at here. Another about 3 minutes, and then we'll wrap it up, and then we'll start the debrief. If you have any question, you can just send me in the chat. Okay, so are we ready to share our expressions? See, Actually, this is a common question that, or a comment that I get often when I do workshops like this. The reason why I became so interested is because, in my culture, when I was growing up, everybody had to learn one artistic expressionist form. Like my sister learned vocal music. My cousins, someone learned instrumental music. I learned art. You won't know that looking at what I did today, but this was obviously rushed. But that's why and every time I do anything related to art, it makes me feel better. It makes me feel, closer to something. It's a creative expression. So to do something like this, you don't have to be an artist. What you have to be is an expressionist. And it doesn't, that's why, this is because we are in a virtual setting. That's why we are having to draw. In a real setting, in a real body mapping setting, you don't have to draw anything by hand. All you have to do is you first have to trace. And for that, you would already have an outline. And then rest, all the expressions are, it can be very, very abstract. And during the debrief, you will explain what you mean. That's why when I showed you those pictures, those are examples, but even outside that context, it would be hard for someone to understand. So does that mean that it's not generalizable? The art itself is not generalizable because it's very individual and personal, but the method is very much generalizable. You can have up to, depending on how much space you have, because people have to trace their bodies, and how much time you have, you can have up to 20, 30 people in a larger room doing something like this at a time. So just talking about scalability, this is again a community-based method, so it cannot be generalizable the way a statistical data collection tool would be, but this gives much more in-depth understanding of your participants' emotions or feelings, and most importantly, their challenges. So if it is okay with you all, then I'll just share mine. Okay, I don't think it can be seen because I had I don't know how I'll share it. Can you see?
Dr. Chakrabarti, if you remove the filter from your
Oh.
background,
How do I do that?
if you go to the video icon and then click the up arrow, and then
Okay.
choose virtual.
It does say none though.
Oh, okay.
Okay. Is it okay? I think that's how it should be. Is it visible? No?
I can see it, yeah.
Okay. Thank you. Okay. So what I did here today is I drew obviously an outline of a body, a very rudimentary, very crude way of doing it. So I identified, first we had to identify our audience. I identified my audience to be my students, and my communication method would be classrooms and advising and the work that I do with different committees. Inside my body, I drew a heart and also a clock. That the heart represents that I'm always thinking about my students, but I also have to think about my family. And the clock represents that I'm limited by time. I only meet them certain hours of the day or the week or the semester. And I'm limited by time of how much I can communicate with them about how their education impacts them and how they should be keeping in good health to be performing best of their abilities. I believe I also have something inside my body that's 4+1. That's my teaching load as a tenure track faculty member. And then I also have to do research and surveys. Those are the things that I wrote here. So outside, something that I cannot control, something that's about my students, outside my body, I drew another clock. My students always complain about they don't have enough time to do all the work that they need to do. And then I also drew a computer screen and I wrote Twitter, Facebook, Instagram, Netflix, Amazon, etc., etc. So my students often tell me that they couldn't finish their work and that's why they are stressed because they were watching Netflix late into the night. So all these distractions are not something that I can control, but they are integral part of my communication with my students about their studies that ultimately leads to their anxiety. So the health issue that I'm identifying here is anxiety. Because of my limited time and being a single parent, be having too much of workload, these all add to stress and anxiety and ultimately sometimes depression. So that's my health issue or my limitations and also my students. Then mobile phone is a big distraction for them. Again, they get into that and spend so much of time. They don't utilize their time efficiently. They're always worrying about money. And that's why I have some dollar signs here. They are always worrying about money, and that adds on to their stress and anxiety about studying. In where I teach, I have a large number of students are non-traditional students with family members. And I have drawn a picture of a photo frame with family. And that is something my students always add that they had last semester, for example, a student had to take a semester off because her father came back from deployment as a disabled veteran and she needed time to take care of her dad. And she was too sad that her father, who had spent his life in the military, was now disabled. At the end of this semester, for example, next semester, I will have a student who goes into maternity leave for an entire semester. So she wants to take that time off and that she will delay her graduation and she's very stressed about that, but that's something that she cannot avoid. So that's why their stress and anxiety is always impacted by their status of being a family member. They are worrying about money and their distraction and limited time that they have to do everything in their life. The last one that might not be very clear here, if you can see, I have drawn some like lava-like structures at the bottom of my feet. I'm representing that as a tenure track faculty member. I'm still working towards my tenure. I feel I'm always on a shaky ground that I have to do so much to be able to keep track of my own position as a professional. So that also adds to my stress, and that also kind of moderates, I would say, impacts the way I am able to communicate about things that are not strictly or perceived by my students as strictly academic and educational. So that is an example, not a very good one, but that is an example that you can quickly do in 15 minutes. And then this is the debrief that you can ask your participants to express and each individual symbol would mean something very close to them. Anybody else wants to share? If you have seen in the chat, Rebecca shared hers. Rebecca, is it okay if I share yours in the screen?
Sure.
I should have actually, let me see if I can.
So I really wasn't in line when they were handing out artistic talent.
Again, this is not about artistic,
I
this is
know.
about expressionists, but
I know.
yes, go ahead. If you want to share,
Yeah.
map
So
them inside and outside.
yeah. So I work a lot, as I said, with the homeless population, and there's a lot of resistance to them participating in programming. And I just kind of see programming as a way to provide education and a variety of things. They're very transient, but I think that internally, both within myself and with my team, we try to think about better ways to communicate and consider better alternatives. I think that it's within our ability to have loving kindness and compassion as a part of our work. I think it's important to meet people where they are, and that's a little bit of a challenge, but we can do that. I think sharing our personal experience and just kind of being with people is just really important. And so that's it.
Beautiful. Anybody else wants to share? We have about 3 minutes. So when I logged in, it said 90 minutes, but I was originally told 60 minutes. I'm not sure about the time, but we'll try to wrap it up in next 3-4 minutes, if that's okay. Anybody else wants to share? Just show their work or just explain things that they experience in their work. I'll stop sharing.
I can go super quick.
Yeah, sure.
Okay. So, oh, I have my black background blurred. Okay, I'm black. Okay, so this is my body, and I just put some words just to kind of get my ideas on the paper, and then I kind of added symbols later. But my main challenge is making sure that my work is there's a better term for it, but like culturally competent. I work with tribal communities, and they're very unique population, and each tribe is very different from the next one. So like there's a lot of different challenges that come with trying to effectively communicate and help them know how to effectively communicate and into their own communities.
Yes.
So sometimes I have a little bit of low confidence, like shaky knees, and like, do I actually know what I'm talking about? I don't know. I feel very confused or lost, so I have like a little question marks. But there's also just kind of like an inherent lack of trust from the communities because we're coming in as an outside health agency, and then there's not a lot of good history between tribal entities and organizations like ours. So it's important to acknowledge that there's a lack of trust and know that it is a challenge, but it can be overcome just very slowly. You have to build the relationships with them. My work is definitely hindered by the inability to meet in person. That's not something I can control because of the pandemic, but that definitely holds us back. Just we can't meet face to face to build the relationships and build the trust.
Mm,
And
this
then
is beautiful.
thank you. And I drew roots and like a heart because I'm a tribal member as well. And so when I see these communities, I see like myself in those communities as well. I see like they're reflected back. And so they keep me rooted to my work and keep me grounded and remind me of how much I, deeply care and how much I love these communities. So that's it.
You, Darren, just on a unrelated but somehow related note, since you mentioned about one of your challenges to be cultural competence, and you did mention that that is not the perfect term for it. There is a huge body of work within health communication, the culture-centered approach. Have you ever thought about that? So if you want, you can just get in touch with me after that because we have to wrap up. We're 1 minute past time. But if you want to know more about that, there is a body of work that does a lot of work with not just tribal communities, but different cultures. And it is called culture-centered approach. So you can look into that as well. So thank you so much, everyone, for participating. If you have more questions, I believe you can find my email from the list of speakers. Again, thank you for attending, and I hope you learned something and you would be able to use it in your work. Bye.